Your medication, we're gonna say, says midazolam on it, okay? Your order is 1 milligram, and it's 1 milligram, okay. I thought we were gonna do more med math.
Oh, I thought that was a 2 in 1.
No, this actually says lorazepam, and it says 1 milligram. Are we gonna do med math on confidence?
I think, oh yeah, almost, definitely. So I think that should say
2 milligrams in 1 ml.
2 milligrams in 1 ml. Absolutely.
So we're gonna pretend this says midazolam, and it says 2 milligrams in 1 ml. So that means there is 2 milligrams of lorazepam in here inside of a 1 ml vial. Does that make sense to you guys? But your order is to only give me 1 milligram. So then how much do you guys have to waste, and how much are you giving me? Half, right? So then 0.5 mLs, and you're giving me 1 milligram, right? Okay. When it comes to your like high risk medications, your midazolam, lorazepam, you have morphine, Dilaudid, your pain meds, you guys have to make sure that you draw up everything that is in this vial. You don't just draw up what it is that you need, because whatever you've drawn up, there might be an air bubble in here. Anything. You could just, and then if you throw this vial away, if you have a person who is addicted to drugs, they will go into the sharps container and try to fish this out, okay? So whenever we're wasting, you want to draw up everything. And then because we are wasting basically a sedative type medication, you want to make sure that you are showing this to another RN. So there are certain medications that are double verifiers for your RNs, okay? This is one of them. All narcotics are double verifiers. Benzos, insulin, okay?
Heparin.
So heparin, please heparin. So you're gonna have to have another nurse verify that you actually drew up everything in here, and then watch you waste it, and then show them, this is what's in here. This is, this is the medication I'm giving, and this is what the order says, okay? When you guys are verifying for your nurses or for your coworkers, your friends, okay, make sure that they're actually doing what they're supposed to, because if they say, I'm giving 1 milligram of Ativan, but you don't know that they have a problem and they're actually pocketing this, you're going to be the one to lose your license, okay? Because if I'm an addict, I can just go to rehab and I can say I'll do better, right? And you'll let me keep my license. That's what the BRN does, okay? But you were supposed to verify me, but we're friends. So you thought that I was doing my job. So insulin, whatever meds you guys are verifying, please make sure that you're actually verifying it. Don't just get in the habit like, oh, I trust you, girl. Go ahead. No, don't trust anybody, okay? Even if you've been friends with them 20 years, people make mistakes too. Maybe I'm not an addict, but I just made a mistake, right? So just make sure you guys are being safe, okay? So 1 milligram. So I'm gonna do, I have gloves on, okay? Alcohol in there? Yes. Okay. I'm gonna remove that cap. If I can. Oh my gosh. Okay. I'm gonna remove my alcohol prep pad. I'm gonna scrub the top of this vial for 30 seconds. I'm gonna let that dry. I'm then going to remove the cap. If it was a stable base, then I would just keep it right there, but it's not. So we're gonna go in. We're gonna draw up everything that's in there, okay? Remove that. I'm gonna get rid of the air. I'm going to enact my safety, okay? Then there's gonna be like a receptacle or like a bin that you guys it's gonna be in your med room. You're gonna go over to that. It's usually, is it gray? Or your guys is black?
It could be different because like at Desert, for example, we have these bottles that kind of look like it's not on that one. If you saw the Sharps container that was at Cassie Station, that big bottle, it looks a lot like that. It's called an RX Destroyer, and you have to waste into there.
Okay. So it's usually in the bedroom, okay? Yeah. We're not doing this over a trash can, okay? So I drew that up. I'm gonna go waste into my RX Destroyer receptacle, whatever you wanna call So I have technically 1 ml in here, okay? Because that's what was in my vial. I'm gonna go up to half. Okay. And then I'm going to take my vial and I'm going to show it to my second RN. And I'm going to have him verify that there's half an ml of Ativan in there and that that vial says Ativan. Okay? So now I can go to my patient's room, do my whole knocking, gloves, privacy, hand hygiene, all that stuff, verify name, date of birth, allergies, right? Then I'm going to grab a new flush. If you don't have Cural's caps or just the caps, you're going to grab an alcohol prep pad and you're going to scrub the hub for 30 seconds. Before I do that, I need to ask my patient for their consent. Are you having them do, like they have to tell us what Ativan is for, or are you just having them do the skill?
They should know what they're giving and why they're giving it.
It's wonderful. I love that answer. Tell me what I'm getting and why I'm getting it, and then at least 1 to 2 side effects of this medication. Okay, so it's Ativan, anti-anxiety medication. It's going to make you feel drowsy and kind of sleepy, right? But it should reduce any anxiety that you're experiencing. So if I'm gonna feel drowsy, what do you think that you guys should tell me?
What should we tell you? Don't get up.
Don't get up too
Thank you.
fast.
Please don't get out of bed by yourself. If you need to get out of bed, please call me, right? With these type of medications, your narcotics, anything that's gonna create any type of sedative effect, you wanna make sure that your patient, that you have oxygen, if not on your patient, or at least have a nasal cannula like connected, kind of already set up. Because what happens to people when they become drowsy, you're not just going to, it's not just gonna reduce your respiratory rate, you're gonna get drowsy first, and then that's when you're going to stop breathing. Does that make sense? Because you're just so tired, your mind is not connecting with your lungs telling you, take a breath right now, take a deep breath, right? So make sure that you guys are educating your patients, okay? So I don't care what side effects you tell me about, just make sure you tell me it's Ativan, what are the side effects, and basically what it is I'm getting and why I'm gonna get it, right? So I've done all those things, I've scrubbed the hub. Last time we had them, it was connected, right?
Yeah.
Okay. So, because D5 half an S with 20 MEQs of potassium is compatible with cefazolin, it is okay for this to be running on your patient, okay? Those are the meds that we're gonna be giving during competency. But Ativan is not compatible with those medications. So, because it's not compatible, what you'll see, what you guys are gonna see in the hospital, if it is compatible, and hopefully they've checked, is I'm sure you've seen a lot of nurses kind of pinch this off right here and then administer the medications through here. Have you guys seen your nurses do that?
Yes.
That's called Y-siding, okay? That means that whatever I'm administering through this port is compatible with all of this hanging, all right? Now, if you were to enter the medications, all 3 meds, into Lexicomp or Metadex or whatever, it's gonna tell you that Ativan is not compatible with these. So then it's gonna say not Y-site compatible. So what that means is, because it's not one of those meds I told you that can't be bolused, these medications I can flush and it's not going to kill my patient, okay? I'm going to pause my pump, okay? I'm going to do my roller clamp, disconnect from the pigtail, okay? Put a Cural's cap on there if my hospital's got them. Take my alcohol prep pad, scrub the hub for 30 seconds, grab a brand new 10 ml saline flush, and I am going to flush this line. Does that make sense to you guys? Because these medications are not meds that are high risk that are going to kill my patient. Okay, so I can flush this line so that I can administer my Ativan. So whenever you're trying to give a medication, You wanna make sure that you flush at least the full 10 ml, because you wanna make sure that you get it completely cleared out of that vein before you administer your medication, okay? So I'm gonna flush the full 10. I'm gonna disconnect. I'm gonna grab another alcohol prep pad, scrub the hub for 30 seconds. I'm going to grab my Ativan. I'm gonna connect. And then you guys are gonna look up, before you do this competency, how long your push rate is for this, okay? So whatever that push rate is, that's what I'm gonna do. So if it's 2 minutes, that's 2 minutes of me and Mr. Brown hanging out, chit-chatting while I push this, okay? So you'll tell us what that push rate is. You don't have to actually do that for competency, just verbalize to us. I would push it over whatever rate, right? So you're gonna administer that med. You're gonna disconnect, grab a brand new saline flush. Since I haven't touched the skin, I don't have to actually clean this again. Just grab a new saline flush, connect, flush it with the full 10 ml. Because I put a Kairos cap on here and I waited 3 minutes for it to actually do its job, now I can take that Kairos cap off, reconnect, and restart my pump. Okay? So Y-side compatible means whatever is running in your IV tubing is compatible with whatever push you're going to give give to your patient, and you can give it right here. Do you see how that looks like a Y-site? That's what that means, okay? If it says it's not Y-site compatible, you have to stop whatever you're running, if you're able to, right? And then you're going to administer straight to the pigtail. Does that make sense to everyone?
Then you start another IV?
Yes. This is why you see your patients in the hospitals with multiple IVs.
Yeah.
Or PICC lines. You guys have seen PICC lines, right? So that's why you'll see them with all these different things. It's because we're administering so many different meds, they're just not compatible. So they need more lines. Okay. Any questions about this?
Not about this specifically, but in practice, if the patient did have 2 lines, you would just put the Ativan in the other one.
Yeah, for sure. If the other one's just like saline locked, or even if it's running something else, as long as it's compatible, or even if it's not, just, I mean, the same thing, right? But this is why I always say my patients should always have 2 lines, because our patients are sick. Like, they're requiring a lot. So having 2 lines is always great. Having 1, that's just like a disaster waiting to happen. It never fails. But yeah, any questions on this IV push in particular?
Just know that these are the ones that you cannot push, the ones that you told us earlier.
Mhm.
That's it, right? So, other than that, just check compatibility. It's not compatible, do what you just did.
Yep.
Perfect. I mean, for now. Perfect.
Yeah. You guys have to just, like I said, ATI explains it, really understand it so that you don't hurt somebody. That's just, I mean, we have so much going on. We have so many different patients, so many different medications, compatibilities. As long as you understand what it is that you're supposed to do, and then the more you see the meds and you get familiar with them, like, you'll know, like, oh, like this is amiodarone, like I can't run anything with this.